This webinar recording contains audio descriptions for the blind and visually impaired.
Welcome, everyone. The title of today's webinar is School Medicaid Cost-Based Rates, Best Practices and Key Considerations for Setting Rates for Covered Services. This webinar is being organized by the Oregon Health Authority, OHA, and the Oregon Department of Education, ODE, with support from WestEd. As you might know, the Oregon Health Authority and Oregon Department of Education are taking a phased approach to expanding the Oregon School-Based Health Services, or SBHS, Medicaid program to meet the needs of new districts and ESDs across Oregon. And today we're hosting a webinar to cover the cost-based rate setting process, as well as updates to that process after the fall of 2025 OAR updates. I'll briefly introduce you to our webinar team, some of whom you will hear from today. From the Oregon Health Authority, we have Jennifer Smith, Lisa Baxter, and Judy Weaver. From the Oregon Department of Education, we have Jennifer Dundon and Shelby Parks. And I am Betsy Garcia, and I'm joined by my WestEd colleagues, Jeremy Ford, Lisa Eisenberg, and Lisa Morris. WestEd is a national education research and technical assistance provider and is providing assistance to OHA and ODE to support the SBHS program expansion. Our objectives for today is that by the end of the webinar, you will understand the purpose and requirements for completing the cost worksheet. You will learn how to prevent common mistakes made on the cost worksheet, and you will understand relevant changes and guidance for adding new school-based health services, or SBHS recognized providers and services.
Webinar agenda.
To achieve those outcomes, we will start with a quick overview of the program. We will do an overview of the rate setting process and the cost worksheet methodology. Then we'll talk about the ESD and school district billing relationships. We'll have a brief overview of the changes to the worksheet and then talk about some best practices before going into questions and answers and closing and sharing that resource page that I shared, that I talked about a few slides ago. So I think many of you are familiar with the program already, but let's just do a really quick program overview to make sure that we're all on the same page. So the School-Based Health Services program provides reimbursement to education agencies for medically necessary and appropriate Medicaid covered services provided to children and young adults, birth to 21, rendered in the education setting. The reimbursement provided by the SBHS program only covers services provided to children who are enrolled in the Oregon Health Plan or Medicaid. And school-based Medicaid provides a flexible funding stream that may be used to increase access to comprehensive school health and behavioral health services, which we all know is a critical part of the healthcare safety net for our children. And finally, the SBHS services program can cover both IEP and non-IEP related services, as long as those services are provided by an SBHS recognized provider. Covered services under the SBHS program include assistive technology services, audiology services, behavioral health services, dental services, nursing services, occupational therapy services, personal care services, physical therapy services, physician services, and speech language pathology services. SBHS covers both services that are planned for under an individual plan of care, as well as episodic occurrences of health conditions. For these services, both evaluations and assessments and health services are covered. Care coordination is also covered for reimbursement through the program. And as I mentioned in the last slide, the SBHS program allows education agencies to be reimbursed for non-IDEA services as well as IDEA services.
Examples of IDEA services include evaluations and assessments, health services, care coordination, and specialized medical transportation. Non-IDEA services include evaluations and assessments, health services, and care coordination.
SBHS recognized providers are those providers that provide the services to your students. Note that these providers used to be known as medically qualified individuals, but that language changed this year to be inclusive of new provider types that were added with the OAR updates earlier in the fall. These providers are also those providers whose costs would go into the cost calculation worksheet, which we will describe further in the next section. For accessibility purposes, I will read the list of providers that you see on the screen. So under behavioral health services, we have licensed psychiatrists, licensed psychologists, psychologist associates, psychology technicians, licensed clinical social workers, clinical social work associates, licensed professional counselors or LPCs, LPC associates, licensed marriage and family therapists or LMFTs, LMFT associates, Teacher Standards Practice Commission or TSPC licensed school social workers, TSPC licensed school counselors, TSPC licensed school psychologists. Under rehabilitation and therapeutic services, we have licensed occupational therapists or OTs, certified OT assistants, licensed physical therapists or PTs, licensed PT assistants, speech language pathologists or SLPs, SLP assistants, and licensed audiologists. Under dental health, we have licensed dentists, expanded practice dental hygienists, and licensed dental therapists. Under nutrition services, we have licensed dietitians, and nursing services, we have nurse practitioners, registered nurses, licensed practical nurses, and unregulated assistive persons or UAPs. And finally, under physician services, we have medical doctors, doctors of osteopathic medicine, doctors of podiatric medicine, and physician's assistants. And one last reminder about the program. Billing providers are who most of you represent. So school districts, education service districts or ESDs, early intervention, early childhood special education or EIECSE contractors, and state institutions. And billing providers need to enroll in each program, IDEA, non-IDEA, and EIECSE separately to bill. For example, if I'm a school district and I would like to bill for both the IDEA Health Services and non-IDEA Health Services program, I will need to enroll in the SBHS program 2 times. This is important to note since it has implications on the cost worksheets and the education agencies need to complete, and we will discuss this later in the webinar. So that is it for now for our overview of the SPHS Medicaid Services Program. For additional information on these introductory slides, please see our March 2025 webinar, which Lisa will put a link to in the chat. At this time, I'll turn it over to Lisa.
Great. Thank you, Betsy. So now we're going to get into what we're all here today to talk about is cost-based rate setting. So this will provide you an overview of the cost-based rate setting with a quick note that in the past, this process has gone by other names. It's been called cost calculations, cost setting, and moving forward, OAJ is going to call this process cost-based rate setting. So the purpose of the cost-based rate setting process is to establish unique cost-based hourly rates for each enrolled billing provider. Again, these are education agencies by program. So as Betsy just mentioned, program is EIECSE, K-12 IDEA, and non-IDEA. And to establish and report cost-based rates for SBHS recognized providers based on actual audited expenditures. So one of the things that happens in this program is you have practitioners that are delivering services, and then the education agency bills OHA, the Oregon Health Authority, for the services provided. And the cost-based rate setting process establishes what those rates are for those services, what an education agency will bill OHA for a set of services. And to establish cost-based rates, education agencies must complete the SBHS Medicaid cost calculation worksheet each year. So we're talking about sort of two things here. We're talking about the cost-based rate setting process and the cost calculation worksheet, which is the document, the spreadsheet that y'all fill out to establish those cost-based rates. Going a little bit more into cost-based rates and understanding cost-based rates, as I just mentioned, it's important to remember that every covered service in the SBHS Medicaid program is billed at the actual service delivery time, with the exception of specialized medical transportation. So I'm going to give you two examples, which I think are sometimes helpful for illustrating this concept. So, for example, if you're an education agency that has an eligible practitioner that delivers 30 minutes of behavioral health counseling, this would be procedure code H0004. And the education agency bills for the 30 minutes of time providing that counseling. Another example is eligible practitioner, an SBHS recognized practitioner provides 25 minutes, takes 25 minutes to complete a nursing assessment. This is procedure code T1001, and that time is billed at 25 minutes. So to bill for the 30 minutes of behavioral health counseling or 25 minutes for a nursing assessment or any other covered service, the education agency, the billing provider, uses the established cost-based rates that are unique to that education agency. So this ends up meaning, one of the implications of this is that different rates for the same service are established for different education agencies. That is one of the benefits of the cost-based rate setting process, is that it uses your actual expenditures to set these rates. So because those actual expenditures, these are things like salaries and benefits, that differs by education agencies, cost-based rates will look different between those education agencies. Again, we're going to give you another example. The hourly rate for nursing services at ABC School District will be different than the hourly rate for nursing services at Sunrise School District. So the example on your slide shows the rate for nursing service at ABC School District is $156 an hour, and the rate at Sunrise School District is $176 an hour. These are just examples. They're not based on any actual data. These are just meant to illustrate that the similar service would have a different rate because actual expenditures will look different between the two school districts. So now we're going to get into the mechanisms for establishing your cost calculation, your cost-based rates. And we're going to start with an overview of the timeline. So one really important thing that everyone should internalize is the cost calculation worksheet is due to OHA January 31st of every year. And while that is the due date, the process to complete the worksheet starts well before that due date. So we're going to walk you through sort of the timeline to consider as you are preparing and working with others at your education agency to complete the cost worksheet. So starting at the top with step one in the education agency, the standard EA fiscal process. So education agencies take actual expenditures used on health services from the previous complete fiscal year. So July, expenditures spent from July to June in year one of this timeline. After the close of the fiscal year, education agencies audit expenses during the fall and the winter, typically September through January. And education agencies use those audited expenditures that are reported to the Oregon Department of Education in January to complete the cost worksheet. So that brings us to step two, which is the SBHS rate setting process. Education agencies typically work on the cost worksheet from November through January, and then send it to the Oregon Health Authority by January 31st. That's the due date. And then during the months that follow the submission of the cost worksheet, OHA reviews and accepts cost worksheets. So this slide continues on with the timeline, kind of picks up the timeline where the process on the previous slide left off. So again, just as a reminder, once education agencies complete and submit the cost worksheet, which is due January 31st, OHA reviews and accepts costs to establish cost-based rates. And once those rates are approved by OHA, the EA, the education agency, can use those rates to bill for services rendered, which brings us to step number 3 in green. If you're working with a billing vendor, the education agency would report those approved cost-based rates to your billing vendor for use during the calendar year. Since rates are typically reviewed and accepted in early spring, this is often sometime between February and April, those rates are used retroactively for services provided starting January 1st. So it's important to remember that this timeline sort of overlaps at important steps. And then those rates can be applied to services that are provided throughout the end of the calendar year. So from January 1st to December 31st, you're using your approved rates, cost-based rates. So services rendered throughout the calendar year are billed to the approved rates. And I think it's important to acknowledge that OHA allows for retroactive billing up to 12 months from the date of service. So while there's a little bit of that overlap between January and April, once those rates are approved, you can bill for services retroactively that were provided starting January 1st. All right, the next section is on the cost worksheet methodology, which will describe how rates are created through the cost worksheet. Again, the cost worksheet is the spreadsheet, the document that you fill out as an education agency and submit to OHA on January 31st. So for the 2026 cost calculation worksheet, the core methodology remains unchanged. So if you've completed the worksheet before, maybe you're lucky enough to be Sarah Foster, who's completed 35 worksheets. This will look similar to you. If you're new to the program, it won't be drastically different than other worksheets that have been submitted. So you can always reach out to a peer at another education agency to provide support, because the core methodology is mostly staying the same from the previous year. So the current cost methodology, this is not different, establishes a cost per hour for each discipline category. This is not changing. And when I use the term discipline category, this means a grouping of SBHS recognized providers that are in similar categories. And I'll explain a little bit more about what that means shortly. An education agency may report allowable costs associated with SBHS recognized providers, such as the ones listed on your slide, plus an ODE approved indirect rate. So the allowable costs can include salaries and benefits, materials and supplies, staff travel, billing vendor and Medicaid coordinator costs, and associated supervisory and support costs. And I want to really note that the actual worksheet that you fill out has pretty detailed instructions that will walk you through adding all of these allowable costs into the worksheet that will calculate each cost-based rate. So as mentioned earlier, the cost calculation worksheet establishes one rate per discipline category, which calculates the average cost per hour for each discipline category or grouping of similar SBHS recognized providers. So the cost calculation worksheet combines all the costs for supervisory level SBHS recognized providers with their respective assistance costs. So the simplified equation works out to be the total practitioner costs divided by total practitioner time, which equals the hourly cost. And an example of this is provided on your screen. This is an example for physical therapy discipline category. So this would work out as the following. The physical therapist costs, including salary and benefits, equals $100,000 per year. And the licensed physical therapy assistant annual costs, or LPTA annual costs, is $70,000 per year. So combining those costs, total costs are divided by the total annual hours for both. In this case, in this example, this is 500 annual hours for the PT plus 1,500 annual hours for the LPTA. This works out to a combined discipline category hourly rate of $85 per hour. So that's sort of a little bit a simplified overview of how the math works in the worksheet. And again, the instructions on the worksheet will walk you through everyone that's combined in the discipline category. So you might have a question about like, how are the discipline categories defined? That is all provided in the cost worksheet. So this creates one of the second implications that this means is this creates the same rates for practitioners in the same discipline category, regardless of which individual is rendering the service. So an example on your screen is a speech language pathologist, SLP, and SLP assistant employed by the same school district, Sunset School District, and billing for services as part of the district's K-12 IDEA enrollment would have the same rate. So an hour of the SLP's services would be $132 an hour, and an hour of the SLPA's service delivery is also $132 an hour. So I hope that sort of makes sense on how this process looks in actual rates in education agencies. So let's talk a little about cost reporting for multiple programs. So as my colleague Betsy mentioned at the overview, when we refer to program types, we're talking about IDEA, non-IDEA, and ECSE enrollment designations. So education agencies have to establish cost-based rates for each program type they are enrolled in. And depending on circumstances, this may mean completing one cost calculation worksheet or multiple. So let's walk through these scenarios, and I will say that we also have an example on the following slide to further explain this concept. So it's a lot to take in, and just know that we'll hopefully solidify the learning with the examples on the next slide. So let's start on the left side under green. If the program costs and the SBHS recognized providers who render services are mostly or entirely the same for program types, then the education agency would submit one cost calculation worksheet and establish rates that are the same for different program types. So on the right-hand side under blue, if program costs and the SBHS recognized providers who render services are 100% different between program types, then the education agency would submit separate cost calculation worksheets for the different programs and establish different rates between the program types. That's a lot of word. It's a lot of if then. It's a lot of big concepts. So let's walk through some examples on the next slide. So here are some examples of cost reporting for multiple program types. So the first example is when an education agency would submit one worksheet. In this example, a nurse spends 80% of their time on IDEA services and 20% of their time on non-IDEA services. In this case, the education agency reports 100% of the nurse's cost on one worksheet for both programs. And then the hourly rate for nursing costs would be the same for nursing services provided under the IDEA program and the non-IDEA program. So the second example is when an education agency would submit multiple worksheets. In this example, we have one nurse that spends 100% of their time on IDEA services, and a different nurse spends 100% of their time on ECSE services. In this case, the education agency would report separate nurse costs on separate cost calculation worksheets. One worksheet for IDEA costs and a different worksheet for ECSE costs. This is the last slide of the cost worksheet methodology. So let's also do a quick overview of SBHS transportation costs. This has not changed from last year. There is no expansion of transportation services outside of IDEA. So costs associated with specialized transportation may be claimed for children and young adults receiving transportation from home to school and back home on dates where the student received a Medicaid covered service per the student's IEP or IFSP. There is a separate Medicaid cost worksheet to generate rates for transportation. And this worksheet is used to establish a cost per one-way trip rather than a cost per hour, as is used for services delivered by SBHS recognized providers. So if you plan to bill for transportation, then you will need to complete the separate transportation cost calculation worksheet. And with that, I'll turn it back over to my colleague, Betsy.
Thank you, Lisa. And now that we understand the methodology a bit better, let's talk about the potential billing relationships between education service districts, or ESDs, and schools. So in our first example billing relationship, the school district contracts and pays the ESD for covered health services. The ESD bills for those services provided by ESD employees and offsets the school district's costs based on reimbursement received through billing. In this situation, the ESD is the one who would complete the cost worksheet. In our second example billing relationship, the school district contracts and pays the ESD for covered health services. The contracted costs are included in the school district's cost calculations, and the school district is the billing provider for services provided by ESD employees. The school district receives all billing reimbursements in this case, and so in this situation, the school district would complete the cost worksheet. And in our third example billing relationship, the ESD under an agreement provides covered health services, documentation support, and staff training to the school district. The school district designates the ESD as the billing provider. The ESD receives all the billing reimbursement and reinvests that into their program budget. And again, since they are the ones receiving the billing reimbursement, the ESD would complete the cost worksheet. So all of the information that we have shared up until this point is basically the same information that you would have received last year. And now we're going to talk a little bit more about the changes to the 2026 cost worksheet that have been made to align the cost-based rate setting process with the OAR updates that were released earlier in the fall. So with the OAR changes that occurred earlier in the fall, there has been the addition and expansion of discipline categories. So first we have TSPC licensed practitioners who will all be combined into one rate, meaning that all allowable costs for TSPC school counselors, school social workers, and school psychologists will be combined to create one new rate. And second, all allowable costs for the delivery of personal care services can be added to the delegated nursing cost-based rate. For those of you new to the program, one part of your cost calculation worksheet is your attestation, where the education agency attests that the information that they are providing in the worksheet is true to the best of their knowledge. This attestation language is relatively unchanged except for the following points. So first, it used to be called the certification language, and now it's called the attestation language. Second, it's been moved, this language has been moved from the bottom of the summary page to a new tab in the worksheet. So hopefully it's a little bit easier for those filling out the worksheet to see it. And finally, new language has been added to the attestation, which is necessary for dual participation or those education agencies participating in both direct services and the MAC program. And now, before we turn it over to questions, let's take a few moments to discuss some best practices related to this process. So first, running any successful billing program and submitting the cost worksheet completely really requires a team to support you. Every school district in ESD is unique, but generally this will require support from your fiscal officers to provide detailed cost information, human resources to help with personnel information, your SBHS recognized provider supervisors to help with messaging, training, and support, a decision maker or someone with authority to sign contracts and move the program forward. And of course, let's not forget the Medicaid coordinator, which some of you might have that role. Having all of these people supporting your team with effective cross-office collaboration and communication is really going to help you succeed in this process and complete your cost worksheet. Next, you will want to ensure accurate cost reporting. The cost worksheet and instructions, which we will provide a link to, should serve as your guide. Earlier, we discussed billing relationships, so the relationship between ESDs and school districts. And to ensure accurate cost reporting, you should make sure that that relationship between the ESD and the school district, if applicable, is very clear in your contract or MOU. And finally, you should ensure all of your systems and processes are well documented. To maximize your education agency's reimbursement, you will want to report your true allowable costs. An education agency may report allowable costs associated with SBHS recognized providers, including their salaries and benefits, materials and supplies, staff travel, billing vendor and Medicaid coordinator costs, associated supervisory and support costs, and as we mentioned earlier, the ODE finalized indirect rate specific to your education agency. And as Lisa mentioned, there are more details on these categories of allowable costs in the cost worksheet and instructions. Internal quality assurance is also really important and are imperative to ensure data accuracy and mitigate your fiscal risk. This can be done through a variety of strategies. So first, establishing your processes and procedures for internal reviews of your cost worksheets prior to their submission to OHA for review and acceptance is imperative for ensuring accuracy of data and, again, mitigating that risk of payback in a Medicaid audit. You should develop and document your processes that can be followed in your absence to ensure continuity, document control, and high-quality cost-setting practices. SBHS cost-setting documents are required to be maintained for a period of 7 years from the date a claim was paid as per Medicaid requirements for record keeping, and these may be requested as supporting documentation in an audit. To help your process of quality assurance and compliance, consider some of these questions which OHA looks for in their Medicaid cost review. So first, some cost checks. Are costs exceptionally high or low compared to the prior fiscal year? Is the indirect rate applied approved for use in the current fiscal year? Were all attributable cost percentages applied? For provider checks, they'll look for hours reported only for SPHS recognized providers. Were all the SPHS recognized providers identified by licensure type and full-time equivalent or FTE? And were the SPHS recognized providers reported employees from the prior fiscal year? And some final quality checks you can check for: was the cost attestation signed, dated, and returned? And again, that is in the cost worksheet. And can the contact person respond to questions regarding the identified cost worksheet? For education agencies who are new to the program, think about a phased approach. So cost calculation addendas can always be added partway through the year if you decide to add new discipline categories. Some questions you might want to consider from the beginning is, what do you need to connect those key partners that we discussed earlier? And also determining your process for deciding which practitioners your education agency will bill for, what services you will bill for, and what students your education agency will bill for. Now, we have shared a lot of information about this cost worksheet, and I'm sure a lot of you have further questions, which we're going to have lots of time for in the rest of the webinar. But I want to highlight another opportunity for questions and a technical training on filling out the worksheet. So this Wednesday at 10:05 will be the monthly Medicaid meeting, and Lisa Baxter is going to use that time to go through the cost calculation worksheet and answer questions about filling it out.
The meeting occurred on November 19th, 2025.
So again, they'll provide technical guidance on completing the cost calculation worksheet. Many of you might have received the invite already for this month's Medicaid meeting, but if you have not, you can sign up for the SPHS email listserv by the end of the day today at the link in the chat that Lisa will put in the chat. These new signups to the listserv will be sent an invite tomorrow for the Wednesday meeting. It's also important to note that these invites can always be forwarded to other interested parties. So if you're the Medicaid coordinator but want to include your business official, you can feel free to forward the invite, and then they don't have to sign up for the listserv themselves. We have a resource page that will be put in the chat, and that should have all of the links that we've referenced today, as well as the ones that I'm going to go over right now. So first of all, there's cost-based rate setting resources, and this includes the SPHS Medicaid cost worksheet and instructions that's been updated, as well as the SPHS Medicaid transportation cost worksheet and instructions. Other helpful resources include the school Medicaid billing manual for school business offices, and the cost benefit analysis and readiness assessment documents. If you have additional questions after reviewing those, you can reach out to medicaid.sphs@oha.oregon.gov for additional cost calculation questions. Some other program resources that we've included in the resource list include previous webinar slides and FAQ documents. And in there, I've listed a few that I think that we think as a team might be of particular interest based on today's conversation. There's also a link in there to the OARs, or the Oregon Administrative Rules, links to the Oregon SBHS Medicaid Program tip sheets. If you have questions about the monthly Medicaid discussions, you can reach out to medicaid.sphs@oha.oregon.gov. And for any direct technical assistance requests, you can reach out to Shelby Parks, a school Medicaid program analyst, and her email is Shelby, SHELBY, .parks, PARKS, @ode.oregon.gov. And of course, please stay in touch with us and the SPHS program staff. You can sign up for the school Medicaid listserv, which we talked about earlier. Check out the OHA and ODE websites, as well as the Medicaid and Education website. And any additional questions and technical assistance requests can be forwarded to medicaid.sbhs@oha.oregon.gov. And make sure you save the date. So in addition to the monthly Medicaid discussion on Wednesday, this coming Wednesday, we will have an office hour for this webinar on December 8th at 10 a.m. To talk a little bit more about cost-based rate setting.